The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Good afternoon and welcome to Chatting with Jocelyn. It's a beautiful day here in South Nashua. It's partly, it's sunny actually now, full blue sky, and it's a little chilly, but it's a perfect fall day. I want to welcome you to the show today, and my guest is, for part two, Dan McGrath of Jester Financial. Welcome to the show.
Thank you very much, Jocelyn. Glad to be here.
I'm glad to have you. 2 weeks ago, we started off with masks and mandates and all that good kind of stuff. And today, I want to kind of delve into what happened on September 20th with the Congress, what decision they made, what law that they passed, because they are in the business of passing law, and how it's going to affect seniors, how it's going to affect us, how it affects Medicare. And then kind of move on to ACA, otherwise known as Obamacare, and what's going on, because those hearings are going to be starting up in November.
Well, those actually may be delayed till the first week of December, but due to what's happening with inside the political arena of what we know as Congress and
maybe a little bit of COVID.
A little bit of COVID. But what happened earlier, towards the latter part of September, is the CARES Act was passed earlier this year. Mm-hmm. Ultimately, the CARES Act is the Corona Relief Act, ultimately giving people or companies not only loans so they could stay afloat, but also giving people extra unemployment money, however it may be. What the CARES Act also did is it made sure that hospitals received funding from federal programs like Medicare and Medicaid. And what they did is it increased the reimbursement rates for any patient that had COVID. Well, the CARES Act, the way it was worded or structured, a lot of it ceased on September 30th. Basically October 1st.
It expired.
It expires.
Yep.
So what Congress went ahead and did is it made sure that the Medicare portion and the Medicaid portion of what's being funded to the hospitals, that will continue.
Oh.
So hospitals are still going to get reimbursement rates from what this legislation is stating of higher reimbursement rates for COVID patients.
So it's still in their best interest to have COVID patients?
Of course.
So are we still not back to surgeries?
No. Well, there are.
Some testing?
There is some testing. There are some surgeries. Where hospitals are actually seeing a bigger issue is the general public, if they can avoid going to the hospital, they are avoiding going to the hospital. And that is putting a crimp in their bottom line.
Well, it doesn't actually help that you don't allow a family member to go in and advocate for the person that's going into the hospital, which I've seen and heard several stories about. I've actually dealt with it last week, and I was not a happy camper. I was not happy. No one should go in and not have someone to advocate for them. And no, it's not the job of the nurse or the doctor or anybody or the hospitalist to advocate for you. It should be a family or a love member or a trusted person that's going to listen to what you're being told. In some cases, you might get a diagnosis that's not very nice, and you stop listening. You know, you hear, you know, you've got diabetes, and you stop listening. You're focusing on that word. So maybe if they allowed somebody to come in with these people, you might build up your traffic again.
Well, it's not just a question of traffic. People are, again, afraid because of the coronavirus. What people don't realize, it is a virus.
Okay, and we've got millions of viruses around us every single day, inside and outside, upside down, outside, inside. So this one's a little different, but not that different.
It's actually not different. It's a virus.
There you go. It's a virus.
So,
and what did your doctors tell us the whole time you were growing up and I was growing up? Go to bed. Stay home. Eat an apple.
Well, it's a little, yes. The way we try to describe it to people now is very simple. we ask a simple question. How many people die from the bubonic plague each year?
2.
You know the answer. We've discussed this before.
This. I did know
the
that.
reason why 2 people in the United States die from the bubonic plague each year is the plague never left us. Ultimately, the plague happened roughly in 1345, 47 with inside of Europe. It was already in Asia where they believe it's now where it was created. It ravished basically all of Europe and Asia for about 100 years off and on. People that lived through it obviously built up an immune system to it or immunity to it. They passed that on to their children and passed it on and passed it on. Now,
So it's now in your DNA?
it's now in the DNA. You now can easily beat the bubonic plague. The bubonic plague hasn't gone anywhere. It's still here. Same thing with COVID. COVID isn't going away. It's a question of its strength, like the flu. The flu doesn't go away.
Right. It mutates. You maybe get a different version each year.
Each year.
But it's still here, and you have to build an immunity to it. Same thing for COVID.
Same thing with smallpox, same thing
Yep.
with polio. They never, ever go away. COVID's never going away. So now what do you do with it? Do you hide from it?
No.
Well, if you hide from it, so the way we look at it is during the summer, viruses should be predominantly, a plague's a different story, a virus should be at its weakest point,
So slightly dormant.
where human beings should have the highest immune levels.
Right.
They're outside, vitamin D, they're around people, they're building their immune system. Well, what did we do as a society this summer? We locked ourselves in,
Well,
put a
we
mask
didn't.
on.
We were told to lock down and quarantine. And
So-
some of us listened.
Well, the majority of people listened. I
Yeah.
still won't wear a mask, or I'll cut a hole in my mask. It's just what I do. Ultimately, what we're doing is we're social distancing to a point where our immune levels are going down. We're wearing masks where we're robbing our organs of oxygen, which is also lowering our immune systems.
Correct.
All the while, you're waiting for the inevitable. You can't get rid of COVID.
Right. It's not going anywhere.
So now, do you get COVID in September or August, September, October, where you're most likely going to beat it, or like the current president, or do you wait till January, February, March when you have the flu, the common cold, a respiratory ailment, and then get COVID? When do you get it?
I don't know that it's up to us. Well, except for the fact if you're making sure that your immune system is being built, that you don't wear the mask 24/7, that you expose yourself.
Shouldn't wear the mask at all.
Right.
They're unhealthy.
Well, mask mouth are what the dentists are seeing. The ICUs are seeing bacterial lung infections from them. Skin specialists and PCPs are seeing bacterial infections in the face. It depletes your oxygen, especially 60 and over, but it also depletes the oxygen for children. So all these children that have been allowed to go back to school, that are wearing masks for the entire time on the bus, going into school, going back on the bus, coming home, they're wearing that mask, but they're still developing. They still have a brain that's developing, and they're being denied oxygen.
Oxygen levels are being cut.
How is that the least bit intelligent? Or does it just make those people who want power feel better?
So that leads to right back to the CARES Act and what's going on on September 20th with what Congress did. So what Congress ultimately did is it made sure that hospitals will receive extra funding for COVID patients. Unfortunately, these extra payments are coming through either Medicare or Medicaid. Both programs are insolvent. Medicare is expected to be insolvent by 2025, that's pre-COVID, with all of these bailouts or all of these overages or new reimbursements that they're paying, coupled with the massive layoffs. Disney just axed 26,000 people, airlines, I think it was 70,000, however it may be, you're taking away money out of the taxable wages that is going into the Medicare system.
Correct.
So Medicare is in trouble. What it needs to do is raise rates. But it can't, because what Congress did is it limited how much Medicare can actually raise its rates. It can only raise it by 25% on an annual basis.
So we're going to be looking at, for our seniors,
About $180 a month. this year.
$180 a month.
That's the
from
worst case
140.
scenario.
Right.
Now, there's a reason why it won't happen. And it's a reason why the Affordable Care Act also won't go away, which everything sort of ties back into healthcare.
Mm-hmm.
The biggest problem in the country, no matter what anyone tells you, the biggest problem in the country is you have a large group of what is known as baby boomers.
Mm-hmm.
There's about 75 million of them that are all heading towards pensions, retirement, Medicare, Social Security. You have the next generation, which is Generation Z. There's only about 60 million of them.
So there's a discrepancy there of 15 million.
The millennials make about 70 million. Now, if you add in immigration, illegal and legal, both those generations move up, but they're not earning the same amount of income that the baby boomers were earning when
So therefore they're
adjusted
paying
for
less
inflation.
taxes.
So they're ultimately the government's paying or taking in less and paying out more. So now what ends up happening is Medicare can't really increase because here's the problem. We know you have a large group of people that are heading towards the pension system. Your firefighters, teachers, police officers, people that work for the cities, towns, and state governments, they signed a contract, they're entitled to their contract. And the contract states the government's going to pick up their Medicare bill.
Ooh.
So now think of all the teachers, firefighters, police officers, prison guards, Department of Works.
Right, Department of Transportation, all that, yeah.
When they retire and they go on to Medicare, you, as a taxpayer, pick up their Medicare bill.
Wow.
So now, if Medicare increases by 25%,
We now have to come up with the difference for them as well.
so when you look at 2015 was a really peculiar year. Medicare was, at that year, Medicare was found to be going insolvent by like 2026, 2027, and there was a panic. So what the current administration did in 2015 is they decided to raise the Medicare premiums by 52%.
Okay.
The state of New York filed for insolvency. What they found when they did the stress test is no state could actually meet its obligation to its pensioners for the health care bill and still function as a state. So instead of Medicare trying to capture money in 2015 so it wouldn't go insolvent,
They pushed it out.
it had a limit how much it could increase.
Okay.
And that's been going on year after year after year.
So we have state employees, like you said, law enforcement, teachers, fire, et cetera, who in their agreement, in their contract, we, the taxpayer, are going to pick up their Medicare.
Yes.
Plus we picked up their lifetime pensions.
Yes.
Plus we picked up their health care all during the time.
And for their spouse.
And their spouse. Okay. So they come up to retirement time. Well, let me back up. So that sets that up. So then there's people like you and me, and we worked in a regular civilian job, and they took taxes out of our paycheck for Social Security. They took the taxes out of our paycheck for Medicare.
Yes.
So that ideally when we retire, we've paid into the system,
Yes.
as did our employers met it and paid into it too. The government never paid into it. It was we and
Yes.
our employers. So now we retire and apparently didn't put enough in.
Nope.
So
Enough wasn't collected.
enough wasn't collected, whatever. I wasn't in charge of deciding that, so they didn't take enough.
Yes.
And now they say, nope, you got to pay $140 a month out of your Social Security to help pay for it. But in addition, you've got to pay for all these other people.
Yes.
So we paid in for we didn't pay in, they took our money, but we also had to pay for these other people. So we've paid twice
Yes.
for our whole lifetime, and they still want to raise ours.
Yes.
Somehow that just sounds really weird.
Well,
Sounds
you gotta
really
keep in mind,
unfair.
not only are they raising Medicare premiums for you and I, they're also raising Medicare premiums for the pensioners. Granted, they don't pay for it, but the state does.
Right.
So what does the state do?
I don't know.
That's the wonderful part of what's going on inside the country. The biggest problem that you face is an aging population without a plan to pay for them.
So COVID comes along and it becomes a convenient excuse?
It's not a convenient excuse. However you want to look at what COVID is. COVID is a reaction by your politicians or our politicians on how to probably fix the problem while gaining more control.
So you put COVID positive patients in the nursing homes and long-term care, c'est la vie?
One could speculate. This is just a speculation. Right. If you are a governor of, say, New York, and you are behind the 8 ball on tax revenue because your corporations are shut down, your restaurants are shut down, hotels are shut down.
Which, by the way, you shut down, that governor.
And you're bleeding tax revenue.
Yeah.
The President of the United States has already promised that you will not get a nickel at all.
For your mismanagement.
For your mismanagement.
Right.
And your biggest obligation are those people in nursing homes. What do? How do you solve the problem?
You do nothing.
Or you allow
put more patients in there to make
you allow COVID-free patients into nursing facilities knowing full well what the outcome is going to be.
That's disgusting.
That's just one way to speculate. Not
saying they did or they didn't, but it kind of looks like it, doesn't it?
If you look at the data and look at the numbers, and that's all we do. All we do is look at data and numbers and say, okay, here's where the data is. Mm-hmm. This is what the numbers are reflecting. Here's what the outcome looks like. I'm sorry it's not pretty, but they did a certain action, mm-hmm. and because of that action, here is what ends up happening. And what ends up happening is you unfortunately lose the lives of people that are on said pension system, but that also frees up money. An amazing little feature. Yikes. Plus, they're not paying taxes or paying back into the system.
Right.
They're not out spending money with the exception of paying for nursing homes.
Right, so which is a huge amount of money.
What ends up happening? It's just a speculation.
Yep. It's not very nice.
So COVID is the former governor of Rahm Emanuel said, it's a crisis that they're not going to not take advantage of?
They're not going to pass by, yeah.
That's all it is.
Wow.
But that leads us to, now that you know that the states are going insolvent, what's happening and why the appointment of Barrett,
Judge Barrett.
Judge Barrett becomes important, is if she is placed upon the Supreme Court as Ruth Bader Ginsburg's replacement, she's now going to hear the Affordable Care Act, is it constitutional or not constitutional?
Right.
Now, the reason why there's a hearing is very simple. The Tax Jobs Cut Act of 2017 relegated the individual mandate, which is the tax penalty for not having health insurance, it relegated it to zero.
Okay.
The reason the Affordable Care Act was passed into law, Supreme Court Justice Roberts stated, well, it's a tax, not a payment. So we're just taxing you for not having health insurance because the federal government can't force you to buy something constitutionally.
Correct. So they tweaked it and made it a tax.
For not having it.
Right.
Well, because of the Tax Jobs Cut Act and what the current administration has done, the individual mandate's now zero. So there is no tax.
There is no tax. It's there, but there's no tax.
So if there's no tax,
they're not bringing in any money.
No, it's unconstitutional.
Oh.
They can't force you to do anything, but they can tax you to do something.
Right. Right. And if it's set at zero, then
there's no tax, so now it's unconstitutional.
Right.
So it's already gone to the federal courts. The federal courts have already said in two states. One is Texas. The other one, I believe, was Connecticut. Both judges ruled it is unconstitutional. Mm-hmm. So that's what this hearing is coming up.
Coming up in November. Okay.
So the issue comes back to, again, the states are not solvent. They're all going broke. Mm-hmm. So what ends up happening is, under the Affordable Care Act, it expanded what is known as Medicaid.
Right.
Medicaid is the state-sponsored health insurance for indigent people or people with little to no income. The states, for years prior to the Affordable Care Act, that was their obligation. They had to pay for that. Mm-hmm. What the Affordable Care Act stated was, we're going to expand Medicaid, and if you as the state want to come on board with us, we'll pick up, at the end of the day, 90% of your Medicaid bill.
90%?
90%. So within 2 years of this happening, Medicaid explodes by about $1.3 trillion as more and more people jump on board to receive Medicaid because they expanded it. It's now, I believe, roughly 2.1 trillion. I could be off on the numbers. It's been a couple months since I looked at it. So now you have a $2.1 trillion problem payment that the federal government's picking up more than the majority of.
Right.
All because the Affordable Care Act gives them the authority to do it. Well, what happens to this 2.1 trillion and the authority of the federal government to pay it if the Affordable Care Act is rendered unconstitutional?
It's one heck of a big bill.
Yes.
That
Now,
gets added to the national debt.
No, it doesn't get added to the national debt.
Okay.
It gets broken up to the states that have become...
To repay. So so it goes back to the states. They now have to pay it.
So states...
And they're insolvent already, so you've just added insult to injury.
So now you've just blown that Medicaid system up. So now there is no health care. There's no reimbursement to facilities, health care providers, doctors, nurses. They don't get paid. The states can't make their Medicare payment for their public employees, so no one gets paid. What ends up happening? Everything blows up.
Right, and they achieve their single payer program, maybe?
No, they won't. They can't.
So it blows up everything, literally.
Yes, it all implodes. There's only 3 things that can be done.
Keep the ACA?
Well, they're going to have to keep the Affordable Care Act no matter what.
Yeah.
The thing they now need to do is solve this Medicare problem. And the Medicare problem solved...
Medicare or Medicaid?
Medicare.
Medicare, okay.
Once you solve the Medicare problem, you either raise taxes, so people paying in, you cut reimbursement rates to facilities, which always just makes healthcare costs increase because they just raise their rates.
Because it's a percentage. So if you raise more, then you're covering the percentage, raise more. Right, okay.
Or you do what's known as what is Medicare's IRMA, the income-related monthly adjustment amount.
So raise the monthly...
Not a month. So what IRMA is, and your financial professional will never tell you this, what it is, it's a tax on your Medicare for how much income you have. So if you're generating too much income in retirement, they jack up your Medicare premiums. And what they do is they take your income, which is defined pretty broadly as to being your Social Security payment and your traditional 401k, IRA, so money you're putting into your retirement plan, when you take that money out, it counts as tax. Then they're going to use it with your Social Security check, and they're going to raise up your Medicare premiums.
Wow.
So the easiest solution, very simply, is to lower the parameters on who gets hit by Medicare's IRMA and increase the penalties. And then all you're doing is soaking the rich to bail out the Medicare problem. And once Medicare is funded, any overages to Medicare, because the Medicare payments, these IRMA surcharges, don't get paid back into Medicare. Under the Bipartisan Budget Act of 2015, when you pay too much for your Medicare, all the overages go to the general fund of the U.S. Treasury.
Wow. Not back to you.
Not back to the Medicare system. So now you've solved the Medicaid problem.
So let me ask this question. So I feel like we just worked our whole lives to be taxed to death.
Yes.
And because you saved some money or you were told that, you put it away in a 401k, we didn't have 401ks, or you put it away in an IRA or a SEP IRA.
Yeah.
So now you're being punished because that's income.
So
they can make more money.
What we like to tell people, the greatest trick the devil has ever played is to convince everyone the devil didn't exist. Well, what was the federal government's greatest trick? To convince everyone that it was stupid and that it could be beat. So you put money into your traditional 401k because you're going to be in a lower tax bracket tomorrow.
Right.
So they're going to give you a tax break today. And then later on, when you take it out, you'll be in a lower tax bracket.
Yep.
You beat the government. Well, what did the government really do? It convinced you through your accountant and through your financial advisor to sock away as much money into the traditional 401k.
So that they can hit you for it later on.
Isn't it great?
No, it sucks.
I think it's fantastic.
So we're down to about 2 minutes. Tell us about your company and what you do and how you know so much about this.
So ultimately, all we do is we help people, we help financial advisors, accountants, we help anyone, help them plan for what their projected costs of healthcare are going to be. We don't sell any products, we don't sell any investment advice. We just basically run or show you the data of how your financial plan is going to impact your overall retirement. And then because of that, here's the little caveat. As we talk about Medicare, we talk about Medicare's IRMA, here's the second grace. What we also show you is what's really going to happen to your Social Security check. Because your Medicare premiums come out of your Social Security check.
Right.
So you want to save Social Security as well. What you do is you lower the IRMA brackets, increase the surcharges. More people pay higher Medicare premiums. What happens to your Social Security check?
Gets smaller and smaller.
So they don't have to pay out. So is Social Security really going insolvent or going broke? No.
No.
Because they don't have to pay out.
Gotcha.
And all because you're convinced by your employer, by your financial advisor, by your accountant, to continue to do the things that are going to hurt you in retirement.
Wow. So we should all empty our 401ks.
So we do have a couple articles out there. You can find it. One of the ones that we got in a fight with a financial channel that starts with a C and ends with a C. We have an article posted. They took it. I think it's still there. You are better off smoking than you are funding a traditional 401k.
Well, based on what you've just said, that's absolutely true.
There is no reason on God's green earth to put a nickel into a tax-deferred vehicle. But what is all the advice that's being stated?
Put it in a tax-deferred vehicle.
Now, we've just went over how Medicare and Medicaid are blowing up. The federal government's in a lot of trouble, so what's it scrambling to do? Collect more assets or more revenue. How are they going to do it? And what's your financial advisor telling you to do?
Sock away more money.
In the same vehicle that's going to fund the federal government.
Wow.
And take your Social Security check.
And I thought my day couldn't get any more negative.
It's not negative. It's a great plan by the government.
It's a great plan by the government, but my goodness me. All right. We're going to have Dan come back because this is part 2. I think we're going to need part 3 because this is just, it's complicated but not complicated, but you have to absorb it. Thank you for joining me, chit-chatting with Jocelyn, sorry about that, and my guest, Dan McGrath from Jester Financial. We will see you again next time.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.